Hi, I'm Aisha, and this is my health assessment video. All right, so I'm going to come in and close the door, close the curtains, whatever I need to do to provide privacy to the patient. And I'm going to go ahead and wash my hands. I've already taken her vital signs. Blood pressure was 130 over 70, pulse was 72, respirations 16, uh, pulse ox is 99% on room air, and she has regular heart rate and rhythm. Okay, I'm going to go ahead and get started. Hi, Miss Lewis. My name is Aisha. I'm going to be your nurse for today, and I'm going to do a health assessment on you, if that's okay. All right. So we're going to go ahead and get started. I'm going to ask you, what's your name, your full name, and date of birth? And date of birth? 7761. Okay. Can you tell me where you are right now? Baptist South Little Rock. And what time of day is it? 5 p.m. Yes, it is. Also, I'm going to tell you four unrelated words, and I'm going to ask you about these words again later on in the assessment just to test your memory a little bit. Okay, so the words are dog, hat, chicken, step. Can you repeat that back to me? No. Okay. Okay, yeah, that's it. Dog head, chicken step. All right. I'm gonna go ahead and get started with your head. I'm gonna do a head assessment. Okay. All right. So what we're doing is we're just looking for hair distribution, and she does have even hair distribution. Looking at the color of her scalp. Her scalp is tan. I do not see any lesions anywhere in her scalp. I don't see any redness anywhere. Just feeling for lumps or bumps anywhere. And she is normal cephalic. I'm going to go ahead and feel for her occipital lymph node. And while I'm here, I may as well go ahead and check the rest of her lymph node. So we have the pre-auricular, post-auricular, parietal, cervical lymph nodes down the neck, and also she has the submandibular, tonsillary lymph node, and submental lymph node. Also the supraclavicular, none of which are palpable. Okay, we can go ahead and move on to her facial assessment. And the skin on her face is nice and smooth. She doesn't have any flakes anywhere or redness or bumps anywhere on her face. Just looking for facial symmetry, and it is symmetrical. She has both of her eyes, eyebrows, eyelashes on. Both of her eyes are evenly distributed on the top and the bottom. She does not have any redness or drainage from her eyes at all. Her sclera is nice and white. Okay, I'm going to go ahead and test her optic nerve. I'm going to have her to read the badge. So, Miss Lewis, if you could just read the letters to my name on my badge for me. Baptist. Right here, my name. ASHA. Uh-huh. That's it. Okay, thank you. Okay, now I'm gonna shine a little light inside of her eye, and I'm just testing her for extraocular movements. Also, I'm testing her abducens nerve, her trochlear nerve, and let's get started. All right, just look towards me, face me, and I'm gonna shine this light past your pupil. Okay. Okay. And her eyes are reactive to light. Continue to follow my pen light, please. Okay, and she does not have any trouble following my pen light. She does not have any extraocular movements, and her cranial nerve 3, 4, and 6 are intact. Okay, we're gonna move down to her nose. Her nose is nice and symmetrical, it's not deviated on either side. I'm just gonna check in here for patency, and from what I can see, it is not occluded on either side. If you could just press down on your right nostril for me and take a deep breath. Let me know if you're having trouble breathing. No? Alright, and take a deep breath through your opposite nostril. On the other side.
No trouble.
All right, no trouble breathing. Okay, I'm gonna give you something to test your sense of smell, your olfactory nerve. If you could just close your eyes, I'm gonna put something under your nose and you let me know what it smells like. Okay? Okay. What does that smell like? Yes, it does. It's vanilla. Okay. Um, this would be a good time to palpate her sinuses and just let me know if you have any kind of discomfort. I'm gonna palpate up here, her frontal and maxillary sinuses. Does that hurt or feel tenderness anywhere when I touch right there on your face? No? Okay, good, good. All right, also, I'm gonna go ahead and check your mouth and just on the outside appearance alone, the color of her lips is they're pink. They're not dry or flaky and she doesn't have any sores on her mouth anywhere. Can you open your mouth for me? Okay, and with her mouth open, I'm just looking at her oral mucosa. Also, can you stick your tongue out for me? I just saw her swallow. All right, stick tongue out and say ah. All right, I'm able to see her tonsils, and her tonsils, they do not have any kind of drainage on them or exudate. They're not red. I would say they are +1, but they're not, very edematous or anything like that. Just taking a look at her. I just tested her vagus nerve, her uh, what? So that's your. I know it's 9, 12, and 10. So hypoglossal vagus and 9. Okay. Also, I'm gonna go ahead and move down to your neck, and her neck um, is midline. No deviations of her trachea on either side. Before we move on, I forgot to ask you to clench down on your teeth. Let me see. Okay. Yeah, she's able to clench down on her teeth, and that tests um, her facial nerve. Go ahead and press up against my hand with your face. Just testing for head and neck strength. Also, if you can close your eyes, I'm gonna touch your face, and you tell me where I'm touching. Okay, I'm gonna test her trigeminal nerve. All right. Yes, your forehead. Uh-huh.
Left cheek. Right.
Yeah, I did the right one at first. You're right. Okay, and that tested out her trigeminal nerve, and she was able to identify the locations on her face that I touched with my pen light. Now I'm going to take a listen to her arteries, her carotid arteries. Just gonna palpate first, doing one at a time, and I do feel her carotid pulse, do temporal as well, and making sure I do them one at a time. Okay, I'm gonna turn the bill of my stethoscope around and take a listen. And I'm listening for a breathe. And when I tell you to just go ahead and hold your breath, okay? And you can hold your breath now. And hold your breath. All right. All right, and I did not hear anything on either side, which is good. You know, just checking to see if her carotid arteries were occluded or anything like that with maybe plaque or something to close out her arteries, and I did not hear anything. So now I'm going to just pinch just a little bit on her chest, just checking the skin turgor of her chest. And her chest, it does not have any rashes on it or anything. The skin, it is supple. It's soft, and there's no tinting to the skin on her chest. Gonna go ahead and do a skin assessment also on your arms, your hands. There's no tinting to her hands either. Nail assessment, just checking for a cap refill on her fingers, and all of which are less than 3 seconds, so that's good. And I'll go down here and also check her toes as well, and just checking for her pulses on her feet. Uh, and also the cap refill. Her fingernails, the lanula, it is intact, and her nails are convex, um, with the free edge as well. They're smooth. She doesn't have any rough surfaces on her nails. And now we can go ahead and move on to the lung and breath assessment. Okay, I'm going to go ahead and take a listen to your lung sounds. Um, we're going to start up here at the top and just take a few deep breaths for me. Deep breath. And continue taking those deep breaths. Inhale. And we're going to come down. And another deep breath. Those sounds so far are clear. You can hold your arms away from the center. I'm going to listen to both sides. Okay. Deep breath. And keep going. Just listening for symmetry. So far, your lung sounds are still clear. And also listening over here on the left side. Okay. All of which have been clear so far. And if you could turn that way for me, I'm going to listen to your back lung sounds, posterior lung sounds. Okay, turn just a little bit more. Thank you. All right, take a deep breath. Deep breath. All right, keep going. Still listening, and they're sounding good and clear. All right, deep breath. Deep breath. And last one. That's right here. Okay, sounds good to me. All right, now I'm going to check for her lung expansion. I'm just going to place my hands right here on her like mid thoracic lower area. Okay, now take a deep breath and feel for the rising and fall. Okay, and yes, she has symmetrical lung expansion. Also, now I'm going to place my hands on her back, just testing for tactile firmness to feel the vibrations of her saying the phrase 99. So if you could just say 99 for me out loud.
99.
And once again,
99.
uh-huh. And I do feel that vibration. It's not coarse, just small, vibration from her voice. Okay, and turn back around for me. If you have any questions, just feel free to ask me. Is there anything you have a question about today?
No.
No, no questions. Okay, and we do not do breast. I'm sorry, breast assessment on this video, but I would have her to make sure that she does examine her breasts regularly at home. And the way that you will do the breast assessment is you're going to do it in 3 different positions and make sure that your areola is darker than the rest of your breast, and also make sure that the color of your breast it is consistent with that of your thorax. It's not reddened anywhere. You're gonna feel starting at the nipple and move in a circular motion out all the way till you get to your lymph nodes under your axilla here, and you're just feeling for any kind of lumpiness, soreness, tenderness of the breast. And if you find anything that is abnormal, then make sure that you report that to your physician. But there were also 4 words that I told you at the beginning of the exam, and I know it's been a while now, but if you could you repeat those words back?
No, that's chicken and stuff.
Yeah, that's it. Dog had chicken steps. Wonderful. Okay, well, that concludes our physical assessment for today. All right, thank you.